14.
It's September 14. Ukraine Media Center Ukrinform continues its operation. My name is Svetlana Chaparenko. Now we're about to be talking about the role of foreign medical education missions in Ukraine's healthcare system during wartime. I would like to introduce our guests. Joining us are Dr. Oleksandr Razumovsky, President at TCD Global, Fellow of the American Heart Association; Ken Green, Doctor of Dental Medicine, U.S. Navy Commander, retired; Yuriy Kuchyn, Rector at National Bogomolets Medical University; Evelina Kurilets, Director at Razum for Ukraine Charitable Foundation; and Kateryna Potapova, Neurologist Fellow at the Society for Brain Mapping and Therapeutics. So, Miss Evelina, I would like to start the conversation with you. Please tell us about this medical program that your foundation is implementing. What is the goal and what are the results for the time being? Thank you very much for invitation. Today I'm happy to be here among such guests because for our foundation, International Medical Missions is one of the first projects to be implemented by our foundation. Within the program of Health Foundation, we have a co-pilot project that started in the year 2016, and back then, in cooperation with the National Neurosurgery Center, we implemented the visits of American neurosurgeons to Ukraine, where they trained Ukrainian neurologists, neurosurgeons to perform complex neurosurgical interventions. So it's an incredibly valuable experience. Then we've expanded the scope of our activities, and we work with reconstructive surgery, maxillofacial surgery, neurosurgery, as I mentioned before, neurology, orthopedics. And on top of the figures that I'm about to pronounce now, more than 100 medics, doctors, and other medical personnel that we brought to Ukraine so they can train Ukrainian medics in how it's done. We also consulted more than 1,500 patients. It's an incredible number. We've performed more than 250 medical interventions thanks to the doctors who arrived. So imagine the result of that training. Even as of the beginning of the full-scale invasion, I have this story that impressed me a lot when I got a call from a female military, and she asked me to take her son to the hospital. He had epilepsy, and it was a Ukrainian surgeon who participated in co-pilot project. And it's incredibly pleasant because we are witnessing the results that will be working for the years to come. That will be a wonderful example of how to improve the training of Ukrainian doctors. Why have we chosen the way like that? There are no many ways to obtain practical skills by the surgeons. There are cadaver labs, but in Ukraine they do not exist, and the surgeons have to pay significant amounts of money to go abroad to get experience like that. And if a Ukrainian surgeon goes abroad, specifically to the United States of America and other countries, they need a license that they don't have. And in the best case, they just stay in the surgery room, just doing nothing and observing. So here in Ukraine, with the guidance of a more experienced surgeon or the surgeons that have the skills or experiences of more complex medical interventions, they can perform surgery, and it provides wonderful results. Also, I want to mention that there are 10 hospitals all across Ukraine that were involved in this program. We've also brought some equipment, expendable and consumables that were necessary for work with those types of patients. And what's also important, we've made the online broadcast, and more than 2,000 doctors were able to see, and they will be able to see the record of how it's done, even if they had no opportunity or they didn't know about that surgery. That's the results that we've created for the long perspective. The missions are underway. Some of them you've already heard about. Some of them are about to take place this year. So I want to extend my appreciation to all those present here for development of these international missions. And I want to thank for the cooperation and partnership. I am a representative of the civil sector, and we traditionally try not to put ourselves remotely from the government and not to pull the functions of the government on ourselves, but in some parts we become even stronger when we work with educational institutions, when we work with international medical institutions, international medical organizations. We have our resources, we have our network of hospitals we cooperate with, we have certain expertise because the health project, well, I think there is no single hospital in Ukraine that we wouldn't have helped before. We have partners, other partners in the medical sector, patients, Zdrovia and other organizations. We are happy to be in a company like this. We are happy this cooperation has such results.
In your opinion, why foreign doctors, best ones, come to Ukraine to help Ukrainians in this difficult time, and what they bring to our medical system, and how does it influence to our medical system?
Thank you for your question, Svetlana. I will try to be brief. Main reason why I'm here today is that between 2008 and 2018, when United States was involved in war in Iraq and Afghanistan, our private practice where I worked this time was providing transcranial Doppler ultrasound services for several military medical centers in the United States, and even at one point we have our technologists and our services was located in Landstuhl in Germany, where we have major US military medical center. And therefore, from my experience and working together with American neurosurgeons and neurologists, we find out that this transcranial Doppler ultrasound test, couples words about it, what it allows, ultrasound, safe, not painful, not expensive, but we can evaluate all arteries involved in the base of the brain and measure blood flow through there. And what we find out, and we reported it several publications and several presentations during this period, that transcranial Doppler can help a lot military medical physicians how to manage patients with wartime TBI. Therefore, when this terrible invasion started, it was absolutely natural impulse for me to contact, and through Dr. Potapova and through the Bogomolets National Medical University Center, and no question with the help from Razum, which is non-governmental organization in the United States. We are here. We conducted already a 3-day workshop in Kiev, and when on Saturday or Friday we are going to Dnipro, to Mechnikov Hospital, we will conduct another 4 days workshop. And hopefully Ukrainian physicians were able to adapt this technique and use this technique for the service members who were wounded during this terrible, terrible, unbelievable war.
Thank you very much. Mr. Green, tell us, please, about your experience. Why did you decide to come to Ukraine to help Ukrainians? And I know you have conducted a very important workshop for Ukrainian doctors. So tell us, please, about this experience.
Добрий день. Ділля мене величезне бути тут.
Good morning. It's a great honor for me to be here.
Here because first I met Dr. Potapova at a meeting of organization I'm involved with, Society for Brain Mapping and Therapeutics, and Dr. Potapova was a guest at our meeting, and through that I learned more about Ukrainian medicine and military medicine, And my career as a retired commander, U.S. Navy, where I worked in the same hospital that Dr. Razumovsky was associated with, the military hospital in Washington, D.C., I wanted to do something to help the brave people of Ukraine in this terrible, illegal conflict. And because of my own family history of serving, my father served in World War II, my grandfather in World War I, and my involvement in First Gulf War, I felt it was imperative that if I could do anything, I would. And I have a background in training military aviators, pilots, in their decision-making and communication skills to avoid plane crashes, essentially. And I've been able to use that background to also train military medical personnel to avoid errors in their care of their patients. And I thought I could add something to the training that Dr. Razumovsky was going to be giving and contribute something to this effort of protecting Ukraine as a democracy. And believing in American democracy, I believe that making sure that Ukraine democracy lives on is essential and vital and most important. And if I could do any small amount of help, I wanted to be able to do that. And that's basically why I'm here.
Thank you. Really appreciate it to you for your help and for your role in this mission. Пане Юрію, питання.
Mr. Yuri, I would like to ask you, as the head of one of the main educational institutions, medical educational institutions in our country, why these missions are important? How do they influence the future doctors, the patients, and those doctors who are practicing already? Well, the war emotionally, it's a trauma, it's a tragedy, but from the medical point of view, it's a challenge for our country, for our people. And if we talk about parts of this challenge, in the first place are the armed forces of Ukraine who repel the enemy and who try to push it back. And it's a challenge for a medical system because the war completely has changed the structure of mortality and traumatic and the structural trauma, which means that the medical system needs a lot of additional arrangements. And in this environment, we all have to train, we all have to learn the best clinical practices, global clinical practices, and we have to learn from that experience that we're obtaining, because there was no such an experience in the world for a long time. You know, when the heavy weapons are used from both sides, it all requires additional training, and the university that implements its standard courses, standard programs, cannot cover all those matters in full, but at the same time, the university is an educational environment. It formulates the platform based on which we can teach, and we can teach better. And having such foreign missions of global level specialists, it allows us to create the new training process. We should create the proper organization with the necessary evaluation before and after, which doesn't necessarily mean that you can listen to a training course from YouTube and think you've learned something. There is the precise system of evaluation to make sure that the competence level is achieved, the competence level set by the provider of training process. And university is always open to this type of cooperation. I think that it's an important role of the university to join the educational efforts of all providers. Ms. Kateryna, what is your assessment of the level of efficiency of this program? Do you have plans to expand or transform in future? Thank you very much, Svetlana. First of all, I would like to thank all the panelists present here because everybody has made their contribution to make it happen. I've got feedback from some of our participants, practicing doctors from different regions of Ukraine. They've learned something new. They've got the new knowledge. They said that previously they knew that they have a transcranial Doppler gauge, but they were not always using it in their routine practice. But now they are about to reevaluate their strategy, and they discovered how they can use such a mobile and not expensive method in the area along the front lines. So if such mobile devices as the one that we have donated by DVL, they donated this device to National Medical University, and we will use it. So if the equipment like that will be brought closer to the forward edge of the battle area, we will be able to evaluate the condition of the injured warriors and to identify the proper condition. And I will give you a couple of figures to understand whether that project was successful. You know, my figures don't mean nothing. It's about the people who can evaluate it. So we had visitors over 60 years from 6 different regions of Ukraine. We had 3 days workshop where we were examining not only a volunteer who was healthy to evaluate how the blood flow, the healthy blood flow looks like, but we had patient with the mine injury, explosive injury, and a patient with an acute stroke. We are currently waiting for the results of the testing. Like Mr. Kuchyn has just mentioned, we don't only make an event happen, but we also help in the evaluation process. Every participant undergoes a test, and after 70% of their correct answers, they receive the certificate confirming their competences. So I want to extend my appreciations to the doctors who arrived from across the ocean. I want to thank the SBMT, I want to thank the Razum Charitable Foundation, and special thanks to Mr. Oleksandr Razumovsky, who is the doctor of neurophysiology, for his personal contribution and his activity. He personally was explaining every single detail why it's important today and why we need to have this workshop now. I'm open to any questions, and also about the openness to other projects. Currently our team is ready to receive from doctors from Ukraine what are the topics that you want to discuss, what workshops are necessary, because we have a lot of doctors who have opportunity to who have necessary skills and expertise, but they want to know the direction to move. And if you have any such information, we are ready to undertake any projects possible. Thank you very much. I want to give the floor to our colleagues so they could ask questions. Ukrinform, Marina Kožuhar, I would like to ask, maybe based on the latest, on what the latter speaker has said, what is the biggest demand from the Ukrainian medics now? And do I understand it correctly that for the time being there are no specific areas like that you may announce, the areas of work that you can announce for the upcoming month or half a year? Thank you very much for your question. I will give the floor to my colleague because the Razum Charitable Foundation has a co-pilot project, and my colleague can tell you way more about that and make some announcements probably. Thank you very much. Well, look, if we talk about the demand during the martial law, the absolute priority is injury, trauma, the preparation to prosthetics and prosthetics, maxillofacial and reconstructive surgery. This is something that we're facing as a result of the war. But let's not forget that the war did not decrease the number of diseases that existed before the beginning of the full-scale invasion, or even before the beginning of the war in 2014. There are oncologic diseases, there are tumors, there are other types of diseases that require arrival of the surgeons here to share their practical skills and expertise with Ukrainian surgeons. So it's important to be on the same page. We, as Razum Charitable Foundation, we started with tumor spinal surgery, and we realized that there is a huge demand in epilepsy surgical treatment. It was both neurology and neurosurgery. We were engaging the specialists from different countries to improve the level of qualification of our specialists here in Ukraine. And now, in response to the challenges of the war, we work with reconstructive surgery, and we have marvelous results. Unfortunately, sometimes surgeries like that require a number of stages of surgical interventions. This is why the improvement of the professional level of our doctors will ensure proper treatment and further rehabilitation. Thank you very much. I would like to add just a couple of words. Let me just structure those questions that were asked. In case of direct problems, it's the emergency medical aid, but let's not forget about the acute stress reactions, because the injury may be not only physical but also psychological, and it may have very serious results. And the First Lady established all those mental health projects for a reason. National Medical University is involved in all those processes. Yesterday we've undertaken the decision to transform the mental health faculty into the Institute of Psychological Health, because psychological rehabilitation is urgent during the acute phase, because there may be acute reactions, and rehabilitation is for more remote periods. So talking about the first stage, the emergency medical aid, the university is directly involved in these processes in cooperation with Warsaw Medical University and the Polskie Ratownictwo, those who transport the injured ones with the helicopters. We have 8 days training course for the doctors from all across Ukraine. It will cover the emergency medical aid, and in cooperation with the Polish partners, we'll be working shoulder to shoulder. Thank you very much for this addition. If I may, just the last small question. It's known that our doctors, our surgeons, independently on their qualification, on their skills and experience, what you've mentioned in the beginning, when they go abroad, they cannot take part in the practical surgery, they cannot fulfill some practical tasks. Is there, well, now that the cooperation is so close with different colleagues from different countries, maybe it's about time when we should start looking for the mechanisms when the problem with recognition of Ukrainian diplomas may be solved finally. I can comment because I have contacts with many colleagues throughout the world. You know, the medicine is a regulated profession in every country of the world, and it's different even in all the countries of Europe. The situation, like you described, exists in the United States. If you don't have a diploma, you cannot touch a patient, and I don't think anything can be done about that because it's regulated to protect the internal job market. But talking about the European Union, there is similar situation in Great Britain, but for example in Germany, when I was visiting and practicing as the guest doctor, I was directly treating the patients. And the same situation is in Austria. So if you provide a copy of your diploma, you have a right to practice on a temporary basis. It's up to a country, it's not so difficult to confirm your diploma if you want to work for a long time. The whole different thing is that it's very difficult to do it, for example, in the United States, and the practice in Spain is like there the tests are quite difficult comparing to Poland or Germany. So it's just about the country. Every country defends their markets, their job markets. And based on my experience, I can add that there are legal matters that regulate the job market for the doctors, licenses, the level of education, and so on and so forth. But it's mostly done to inspect the quality of the services rendered to the patients abroad. And it's my pleasure now to say that it's painful to me personally how this experience is gained, but some hospitals, the Mechnikov Hospital is a legend not only in Ukraine but even abroad. The number of patients undergoing surgery in extreme conditions, there is those doctors, they are real heroes. There is a surgical practice in Lviv and other cities. The doctors are getting colossal experience. They collect information for further studies, further scientific works, and I hope that our doctors, having this foundation, having this experience, they will be able to share their expertise with their colleagues all around the world, and maybe with those who become the victims of such an unjust behavior. And the city of Kiev also can be counted in. Yeah, that goes by default. I want to add, I'm an assistant to the chair of neurology, and I'm a practicing neurology doctor. I'm not a surgeon, but my colleagues with therapeutic professions, for them the training sessions are extremely important too. So when the foreign doctors show some interest in sharing their knowledge, we are happy to learn such knowledge, but we also demonstrate our knowledge in international congresses. Mr. Rector recently visited a congress in France. Last February I visited Los Angeles, where I met Mr. Green, what Dr. Green has just told you about. So talking about our colleagues, we want to emphasize that a lot of doors are open now. There is a lot of initiatives that are worth joining. So please follow the announcements. Use those opportunities that are available. The war, unfortunately, has happened. It's a fact. And as a doctors, we have to make sure our medical system is capable of coping with the challenges, and as the professors we have to help our future generations of doctors to become better professionals. Thank you very much. If we have no more questions to our panelists, I want to thank for your work on this useful initiative, which is of extreme importance. We were talking about the role of foreign medical education missions in Ukraine's healthcare system. Ukraine Media Center Ukrinform will continue its operation tomorrow. Stay tuned.